Hi everyone, myself Dr. Mallika, a consultant physiotherapist from Ayush. I've seen many patients coming up to me with cervical pain. It could be due to many reasons like cervical disc prolapse or cervical radiculopathy, cervical spondylosis, or any fall of history. But there is one condition, it's merely not a condition or a disorder, but it's an symptom of an underlying cause, which is called as trapezitis. Before telling you about the trapezitis, let me tell you about the muscle trapezius, which has got its name because of the shape it persists. So it runs from your base of your skull, extending till your shoulder girdle and till your thoracic region. It has got three fibers, the upper, middle, and the lower fibers. The upper fibers helps in elevation of your shoulder girdle, and the middle fibers helps in retraction of your scapula. So this is protraction of the scapula and retraction of the scapula. And the lower fibers helps in depression of the shoulder. So this is elevation and depression of the shoulder. Among all cervical muscles, upper fibers of the trapezius also plays a prime role in maintaining your cervical neck posture. So it helps you in maintaining your head and neck in an upright position. A muscle is meant to contract and relax together, but when there is a prolonged contraction or a prolonged relaxation, the muscle will not be able to remove the metabolic waste created within itself, or there will be less blood flow to the muscle bulk. So this is when you start feeling that pricking kind of pain within your shoulder and neck. So when this process continues or when there is increase of mechanical load to the trapezius muscle, it forms the knots within the muscle which we call it as trigger points. So basically when a muscle is functioning, that is when it is contracting and relaxing, it moves to and fro. So when there is increase of load or pressure to the muscle, it forms knots within its fibers which we call it as trigger point. So when you have these trigger points, it will lead you to the referral pain, which means if you have trigger points over your trapezial region, so it will make you feel your pain somewhere between your neck extending till your shoulder or from upper back to the lower back. So when you have such symptoms like pricking kind of pain within your neck and shoulder and the upper back, or if you have stiffness that when you're not able to move your neck completely, or you feel any difficulty in doing your overhead activities like combing your hair, taking bath, etc. What you really have to do is number one, maintain your posture because that's merely a prime reason to make your trapezius stiffness. So if you're in protracted condition or any other postural deformities, you really have to work on your shoulder and the cervical posture. Number two, give slight stretches to your trapezius muscle. That is, stabilize your shoulder and pull your neck to the opposite side on both the sides. So this is how you use stretches to your muscles. And number three, give hot pack and slight massage to the affected area to increase the blood supply at the local site. So these symptoms are usually seen in individuals those who are into overhead activities like teachers who use their board regularly, or carpenters or painters or electricians, or anyone who drives in this position, and the computer use. If you're still suffering from the same problem even after all the home remedies, or if your pain is still aggravating, contact Ayush physiotherapist to get individualized therapy and customized exercise protocol to permanently remove your trapezitis. To know more about Ayush, please go check www.ayush.com.